I'd like to tell you about the case I'm doing today, which is one of my favorites. A breast augmentation in a woman who's had one child. She's young and would like a silicone breast augmentation in a pretty good size. She's starting in the BC range and she wants to go to the D range. To do this, we're picking a high-profile silicone implant. We're inserting it from below the breast using a Keller Funnel and putting it behind the muscle. Then over time, the breast will relax and assume just a beautiful shape. And I'm looking forward to showing you the results.
I'm about to insert a silicone implant into a pocket that I've just finished creating. And what you see in front of you is a thing called a Keller Funnel, which is a very important innovation in breast surgery. And what it does is you put the implant in sterilely inside the funnel and then you squeeze it out through here. And it's a way of inserting an implant with much less trauma to the implant and much less contamination. The results are better, there's a decreased capsular contracture rate, and you'll see how easy it is. So I'm about to insert the implant into this very small incision through here, and I can really only do it effectively because of the Keller Funnel. And I'll show you how it works. In the smaller incisions, it sometimes takes a little bit more energy to get it in, and other times it just flows right in, and it's just such a beautiful procedure. And that's what you're seeing here, is a pretty good size implant put through a very small incision, which creates a gorgeous cosmetic result.
Well, I just finished the breast augmentation case I was telling you about earlier, and it went well. We put a small incision underneath her breast and put the implant behind the muscle. She's now in recovery and she feels pretty good, because when I do this operation, I put numbing medication in the areas that hurt. So she's in recovery, just kind of slowly waking up. It's quite easy and beautiful. There's very little pain. And as she wakes up, we'll start giving her ice chips and give her a little bit of juice, and then she's going to go home. So in terms of the recovery at home, she can expect to have gradually increasing pain overnight that she's going to take some pain medications for, and then it diminishes over the next 1 to 3 days. After that, she'll gradually start resuming normal activities over the next few days, and then can probably go back to work at about 5 to 7 days after surgery. Then longer term, I'm going to have her start massaging her breasts, which will then allow the implants to stay soft and gradually attain this beautiful shape over time. This takes, depending on the person and the size of the implants, between 6 weeks and 3 months, when we'll have a pretty good idea what the final result looks like. And then finally we look at a year, and that gives us a final result. Along the process, her breasts look quite nice. And of note, they sit high at first, and then over time what they do is the lower part of the breast opens up and stretches out, and then the implant drops in, and then you start seeing some of the projection over time as everything relaxes. It's a beautiful process, and it takes a little bit of time. So I always encourage people to be patient for the process.